This is an entirely remote hearing. All microphones will be kept muted as a general rule to avoid unnecessary background noise. Members and witnesses will be responsible for unmuting themselves when they are recognized to speak or when they wish to seek recognition. I also ask that members please identify themselves before they speak. Members should keep their cameras on. Thank you, Ranking Member. Members should keep their cameras on while in the proceeding. Members shall be considered present in the proceeding when they are visible on camera, and they shall be considered not present when they are not visible on camera. The only exception to this is if they are experiencing technical difficulty and inform committee staff of such difficulties. If any member experiences technical difficulty during the hearing, you should stay connected on the platform, make sure you are muted, and use your phone to immediately call a committee's IT director, whose number was provided in advance. Should the chair experience technical difficulty, Mr. Courtney or another majority member is hereby authorized to assume the gavel in the chair's absence. This is an entirely remote hearing once again, and as such, the committee's hearing room is officially closed. Members who choose to sit with their individual devices in the hearing room must wear headphones to avoid feedback, echoes, and distortion resulting from more than one person on the software platform sitting in the same room. Members are also expected to adhere to social distancing and safe health care guidelines, including the use of masks, hand sanitizer, and wiping down their areas both before and after their presence in the hearing room. In order to ensure the committee's 5-minute rule is adhered to, staff will be keeping track of time using the computer's digital timer, which will appear in its own thumbnail picture. Members and witnesses are asked to wrap up promptly when their time is expired. Pursuant to Committee Rule 8C, opening statements are limited to the chair and ranking member. This allows us to hear from our witnesses sooner and will provide all members with adequate time to ask questions. With that, I will now recognize myself for the purpose of making an opening statement. First of all, thank you all, witnesses. Thanks to all the members for attending and for our visitors who are with us as well. Today, we are meeting to explore pathways to help all Americans access high quality, affordable healthcare. Over the past decade, we've made significant progress toward expanding access to healthcare for Americans. Since President Obama signed the Affordable Care Act into law in 2010, more than 20 million Americans secured health coverage, and the uninsured rate has significantly declined. The ACA has also ensured that more than 130 individuals living with pre-existing conditions cannot be discriminated against or denied coverage, 130 million. To expand Americans' access to healthcare during the pandemic, we passed the American Rescue Plan, which has dramatically helped lower costs for families by providing enhanced upfront tax credits to low-income individuals to lower monthly healthcare costs, ensuring premium-free access to silver plans, and eliminating the subsidy cliff so more low and moderate income individuals have access to affordable healthcare. During the last open enrollment period, a record 14.5 million Americans enrolled in healthcare coverage through the ACA and state-based marketplaces. Simply put, the steps taken in the American Rescue Plan made coverage more attainable for millions and these reforms have saved lives. While the U.S. has made progress in terms of coverage over the course of the past decade, millions of Americans remain uninsured or underinsured. This is particularly true for Black, Latino, and low-income Americans, who are even more likely to be uninsured compared to their peers. For more than a decade, some of our colleagues, particularly Republican state attorney generals, have relentlessly worked to erode or eliminate the ACA entirely. While I think all open-minded people recognize that we can always improve on legislation and look back at it, these attacks are unacceptable to the American public. Far too many individuals also continue to be pushed towards low quality and unregulated junk healthcare plans. The ex-Trump administration actively promoted these plans, saddling many Americans with piles of debt. And if Americans don't have high quality coverage, they won't have the care they need. Unfortunately, 12 of these Attorney General-led states, Republican Attorney General-led states, have also yet to expand eligibility for Medicaid to help low-income individuals afford health care, which has left approximately 2.2 million Americans without insurance. In comparison to our peers around the world, our healthcare system is underperforming. According to analysis by the Kaiser Family Foundation, the US spent around 19% of its GDP on healthcare in 2020, whereas the next highest comparable country, the United Kingdom, devoted 13% of its GDP. The same analysis by the Kaiser Foundation found that healthcare spending per person in the US was almost $12,000 in 2020. Whereas the nearest comparable country, Norway in this case, spent less than $7,000. We know that these inflated costs are driven in part by excessive prices for prescription drugs and other health services. Not only does the United States underperform on access, but our peer nations also often better outcomes, better quality care, according to OECD data. Our current healthcare system is broken, and Americans to fix it. The lesson we learned from the ACA and the COVID-19 pandemic is that when we invest in expanding quality healthcare coverage, when we expect providers, insurance companies to perform and have outcomes and performance, we can save lives. That's why Democrats are committed to ensuring all Americans have affordable, high-quality coverage, and I certainly hope that all of us in Congress feel the same way and will join our efforts. As our witnesses will discuss today, there are many approaches to expanding access to healthcare and lots of good ideas about how to get there, such as expanding the Affordable Care Act, establishing a public option, or transitioning to a single payer Medicare for all system. Each of these options builds on the progress we've made and helps us achieve our shared goal of affordable, high-quality coverage for all Americans. I really hope that this conversation can also draw upon some of our own experiences back home as well in our districts. In California, for example, we have taken a number of steps to improve coverage. I'm proud of what we've done in California. I was proud of being very involved with it as chair of the California State Senate Budget Committee for Health and Human Services, as well as being a member of the policy committee in that body when we implemented the ACA. I'm proud of the success that we've had, and we've had challenges. In Contra Costa County here in San Francisco Bay Area, we even have our own version of the public option, the Contra Costa Health Plan, which I am a proud member of as a county retiree. And I can tell you, I wouldn't be here if it wasn't for them. They've saved my life. This public option competes with commercial insurers and cooperates with commercial insurers. We cooperate with Kaiser, which is a dominant player as it started here in the East Bay. We have a collaborative effort that keeps prices low and quality high for everyone in this area. I think it's important that we learn from these and other examples as we discussed how best to deliver the quality healthcare coverage that Americans deserve. I look forward to hearing from our distinguished panel of witnesses, and I look forward to, I know, a robust conversation with my colleagues where we have legitimate differences of opinion, but I really hope, and I hope our experience with pensions in this subcommittee, and I want to thank Ranking Member Allen and Ranking Member Fox for their support in those efforts. For all our differences, there's work to be done, and I hope that we can accomplish real improvements for Americans in healthcare. With that, I'm happy to recognize the Ranking Member for the purposes of an opening statement. Mr. Allen.
Thank you.